Good morning, everyone. Today we will discuss some topics in the continuation of the previous class. So previously we learned about different type of receptors which are related to histamine, and we also learned that among all those receptors, H1 receptor plays a very vital role, at least when it comes to two different parts. One is allergy, and the second one is obviously vertigo and nausea. Now, for these two treatment, there are a number of drugs which are there. However, these H1 antihistamines has been classified into two major sections. One is first generation, another type of drug is known as the second generation. The first generation of H1 antihistamines has further subclassification. First one of them is ethylene diamines. You can understand that there will be ethylene group, and obviously there will be two different amine groups which are present. And some example of such drugs are chloropyramine, antazolene, etc. The next type of drugs are known as ethanol amine. So you can understand it has ethanol, that is high alcohol like structure, and at the same time there will be amine group present. Some example of this class of drug is diphenhydramine and carboxamine. We have also alkyl amines, and phenylamine and chlorphenylamines are two examples of this subclassification of H1 antihistamine, the first generation. Next, we also have piperazines such as cyclizins and chlorcyclizins. Interesting to know here that these type of drugs are mostly used for the treatment of motion sickness. The motion sickness is, you know, that it is a condition when a person suffers from vertigo, and this occurs generally when a person is traveling through a very windy road, or maybe I can give you another example. If a person is going on a joyride such as merry-go-round or a Ferris wheel. So in such cases, some person might face some kind of sickness. Yes, while it is, you might think that it is best to avoid those kind of activities of a joyride, but the more practical effort, like if a person needs to go to a hilly area where the roads are very wind up, in such cases, it is quite obvious that a person might suffer from motion sickness. And first generation of H1 antihistamines such as cyclizin and chlorcyclizin, they are majorly used for the treatment of motion sickness. Now for the second generation, we have acimazole, some of the drugs, and we also have ketotifen, we have cetirizine, and we have fexofenadine. If I ask you, what is the major difference between the first generation and the second generation of antihistamine, the answer here should be that first generation of antihistamine has the ability to cross the blood-brain barrier, whereas the second generation cannot. And that is why most of the first generation of H1 antihistamine, they will have some or the other adverse effect or side effect regarding the central nervous system. But in most of the cases, what we will see in case of second generation, the second generation of drugs do not cross the blood-brain barrier, and as a result of that, it will obviously not cause any kind of central nervous system activity. So what are the therapeutic uses of first generation of antihistamines? Now we already know that it is used for allergy and vertigo, but let's dig into in a little more detail. Obviously, the first one we discussed was allergic disease. It can also be used as antiemetics and motion sickness. Now, classically, if you think about antiemetics, they are B2 receptor antagonist. We shall come to that part a later date maybe. But these type of first generation of drugs will mainly be used for motion sickness, and you can see the emetics or like the vomiting feedback of motion sickness which comes from the nausea, that can be reduced. So you can say that as it reduces the nausea, it will reduce the associated vomiting tendency as well. So we can say that it can be used as antiemetics and motion sickness. Interestingly, this can also be used for insomnia because as I told you already that it has some CNS activity, it can induce drowsiness. Now, for those who are insomniac, what happens mostly is that a person will feel very tired, but due to some reason, the drowsiness will not be there. Yes, there are some classical drugs such as benzodiazepines that can be used, but for example, if we think about insomnia related to hay fever, where allergy takes place a lot, a person is suffering from runny nose or rhinorrhea or extreme amount of cough, and in those cases if the person is not able to sleep, these kind of drugs might be very helpful for them. As we have seen that it has some CNS activity nowadays, first generation of antihistamines are used for Parkinsonism as well. And you know that in case of Parkinsonism, a person has uncontrolled movement of their motor muscles, and motor neurons flares up very quickly, and the skeletal muscles move uncontrollably. So in case of Parkinsonism, these kind of drugs sometimes give a good response. Vertigo is another condition which is associated to motion and especially height. First generation of antihistamine can provide this as well. This can also be used as pre-anesthetic medication as it has some property to bring in drowsiness. Also, in case of anesthesia, remember that due to those anesthetic gases, some person might get some kind of allergic reaction, and to prevent that as well, we can prescribe the first generation of H1 antihistamine. Now, if we go with the example of these kind of drugs, some of the major example is chlorpheniramine, we have cyclizins, we have diphenhydramine, we have dimenhydrate, we have doxepine, hydroxyzine and meclizine. These type of drugs are mostly used for different type of indications which we have discussed in our previous slide. Now let's talk about the general and the specific structure. Here in every single slide you will see this type of general structure here, and there will be several type of replacement. Now if you go back to your previous class, you will remember that we have discussed a general structure of these type of amino acids, and what you will see at the end of the day that these type of structures for every single class of compounds for H1 antihistamines that we will study, it will have almost similar kind of a structure. Now let's start with the first example here. So obviously this is the general structure, and the first drug here will be diphenhydramine. So diphenhydramine, diphen, you can understand, so that two amount of phenyl groups might be present. So if we are thinking about diphenhydramine, so there will be one phenyl group present here, another phenyl group will be present in this case. Now R1, so this place will be replaced with simply an H. The next drug of this class is doxylamine. Now doxylamine in this case, just like for diphenhydramine, the AR1 and AR2 group will remain the phenyl group as it is. However, the major change will be in R1 group, where this will be CH. So remember this one, that these type of drugs are again the first generation. Next we have clemastine. In case of clemastine, you will see that it is actually a change from doxylamine, where you will see that the structure of doxylamine will mostly remain same. However, in case of the AR1, so this one will be having a chlorine group. That means doxylamine and clemastine is almost similar. However, chlorine group will be replacing or chlorine group will be extra from toxylamine. Next we have a class of drugs which is known as ethylene diamine derivative. Now, in case of ethylene diamine derivative, there are a few things you need to remember. As I told you that there will be ethylene group which will be present. Now, you can understand that there is a presence of two carbon chains. So, obviously, this is why it will be called ethylene, or basically it is an ethane. However, as it is this diamine is basically a derivative of ethylene. If you go through your basic organic chemistry, you will remember that. Now, ethylene diamine, you know about ethylene diamine from other cases as well. For example, a very important pharmaceutically relevant substance called ethylene diamine tetraacetic acid. It also has similar kind of a structure, if you remember that. However, please remember that EDTA or ethylene diamine tetraacetic acid will not have any kind of effect regarding this H1 antihistamines. Now, in this case, you will see that almost similar type of structure retains. There are two different amine groups which are present here. In this case, both the amines are not amino acids, but both these amines are basically tertiary in nature, and there will be different type of replacement, and the drugs will be named regarding this type of structure as well. So, the first drug that we have is known as triple in amine. In this case, what we have is that first one will be a benzyl group, AR1. So, benzyl group is something like this. You know that this there will be obviously a carbon which will be present in between. AR2 will be a pyridyl group. Now, pyridyl group, you know, this is the 5-membered ring with nitrogen, and R1 and R2 there will be CH3 groups which will be present. If we go with the next drug, which is methapyrilene, in this case we will see that AR1 will have thiophenyl methyl group. Now, thiophenyl methyl group is obviously there will be CH3 group present, but as there is thio group present, that means there will be sulfur will also be present. As usual, the AR2 will have pyridyl group, and R1 and R3 will have the CH3 group present in this case. Now, next type of drug which we have is thonzylamine. Now, thonzylamine, if we go for the AR1 drug, it will be para-methoxybenzyl group. So, obviously, you can understand that there will be some replacement in this region, and for AR2 there will be pyrimethyl group. Please remember the pyridyl and pyrimethyl group are slightly different. Now, for the next type of drug that we see here, the major class here is known as propylamine derivatives. Now, propylamine derivatives also, they have two different type of subclasses, saturated and unsaturated. We will talk about the saturated type of propylamine derivatives at first. So, this is the general structure. You can see that in this case there will be CH3 and CH3 group will be here, but unlike the previous structure, there will not be any nitrogen which will be present in this case. So, this nitrogen is preferably replaced with a CH2 group. The first drug here is phenidamine. In case of phenidamine, there will be one phenyl group and there will be another pyridyl group, that is pyridine derivative will be there, not the pyridine. Please remember this one. Next, what we have is chlorphenidamine. In case of chlorphenidamine, for this one, that is the AR2, the phenyl group will be replaced with a para-chlorophenyl. That means, in short, at the para position, one chlorine atom will be attached. The rest of the structure will remain same. So, that is why you can even understand that from the name of these drugs also that they are chlorine derivative of one another, and that is why the name is phenidamine and chlorphenidamine. Now, let us talk about the unsaturated part. In case of unsaturated part, you can see that there is a double bond which is present, unlike the previous one where there was only a single bond which was present. That means while in this case there was a CH, single CH group was present, in this case there will be one simple carbon group which will be present. So obviously this is one major difference in this case. Now after this general structure, let's talk about some individual drugs. The first drug which we will think about is pyrobutamine. In case of pyrobutamine, there will be one group which will be chlorobenzyl group, and in other cases AR2 which will be a pyridyl group. The next type of drug is triprolidine. In this case, the triprolidine drug, the AR1, it will be para-toluene group. So para-toluene group means that it will be basically a toluene group or a CH3 group which will be present at the para position. Now for the AR2, there will be pyridyl group as usual for like the previous one. So if we think about the major differences between pyrobutamine and triprolidine, the main difference is basically a chlorine group, the presence of a chlorine group, and the presence of one methyl group. Now let's talk about the piperazine derivatives. Now piperazine derivatives, we have already discussed that piperazine derivatives are mostly used for motion sickness, and you can see that this is the major general structure, where this is the piperazine structure. It is a 6-member double nitrogen group and double nitrogen moiety which we have here. Now the first drug is cyclizine. It's a very simple kind of a structure. In this case it will be a simple hydrogen, and for the group which is adjacent to the piperazine moiety, it will be simply CH3. The next drug that we have is known as meclizine, and for meclizine the R, this portion, it will be simply a chlorine, and if we go for this one here, it will be meta-methyl-benzyl group. So meta-methyl-benzene, you can understand that if we think this is the phenyl group and this is the benzyl group, so meta-methyl means there will be a CH3 group which will be present in this case. Now second generation of antihistamines, as we told previously, that H1 antihistamine may cause some CNS activity. So these type of second generation antihistamine will not be creating any kind of CNS activity. So as we already know that these are antagonists at H1 receptors, it is specific to H1 receptors. This is also a competitive type of antagonist. You can understand, we have also discussed that this has a similar structure with the main histamine structure, and that is why these are called the competitive antagonist. This portion, the next portion, is very important, and it is called the lipophilicity. And the lipophilicity, this is one property, this is very important, that this lipophilicity is very low, and that is why it does not cross the blood-brain barrier. And we all know that if any substance is not able to cross the blood-brain barrier, in such cases you will see that that drug or that substance will not be having any effect on the central nervous system. We know that this is one major important property or major important concept that we must address whenever we are designing a drug which we require to go and have its effect on the central nervous system. Next up, what we have is that these type of drugs are highly selective in nature, and if we see this in details, I need to pause the recording a bit. Okay, so in other cases, what we will also find is that these type of second generation of H1 antihistamine, they do not have anticholinergic activity. Now, why all of a sudden we are discussing about anticholinergic activity when we were studying about antihistamines? Now, if we go back to the structure, you will see that these type of drugs, they have similarities with anticholinergic drugs as well, if we are thinking about the first generation of H1 antihistamine. And that is why in case of the second generation, this was also changed, that they do not have any kind of anticholinergic activity. That means those structural features which were responsible for anticholinergic activity, they were changed as well. Next up, what we have is that these drugs will also show that their anti-allergic activity is quite enhanced. Now, when we are thinking about enhancement of these things, anti-allergic effect, and that is majorly done by the suppression of leukotrienes and antiplatelet factors. Now, these things are extremely important in this case. Okay. Next up, we have some major example of these type of drugs. The first drug here which we are thinking about as is known as acrivastine. Now, acrivastine is you can see, if you see the structure of the drug, if we are thinking about the common structures which are present in this case, the majority of the change is happening in this case. Because the nitrogen, we talked about this one, this nitrogen is a tertiary amine, it will be there. The aryl group 1, AR1, and say this one AR2, they are also present here. So, one major change which we see here is in this case, and that is on the long chain substitution of the AR2. So, this is acrivastine. Now, also you can understand this is subcategory which is basically ethylene diamine. You have already we have discussed about this one. We have also cetirizine. Now, cetirizine, the structure of cetirizine is similar again. However, you can see this is a piperazine just like cyclizine, but you see that along with this piperazine group there is a long chain substitution. This portion is very important as well. Again, if we take some other examples, we have tarfenadine. One major example in this case, you can see that almost in a similar manner we have AR1, AR2, we have this tertiary nitrogen which are present. Again, in short, what we can say is that any antihistamine, they will have this minimum structure present in every single case. If even if there is some structure which you might think on a very first glance that this is slightly different, but not exactly. If you go and dig deeper into the structure, you will see that there will be some changes in all these cases. Now, the same thing goes with loratadine as well, and as well as the astemizole, this structure, they will also have these kind of structure. Again, these are basically piperidine. Now, we will go with some major synthesis of the drugs, and for the first type of synthesis we have diphenhydramine. So, in case of diphenhydramine, we have this structure of which starts with a simple type of a structure, and in this case it is a phenyl substitution of which has a bromine group as well. So, the first substance which we have here is something which we can call diphenyl methyl bromide. Now, this structure is basically a very simple structure, and it might look a little different, but this is basically diphenyl methyl bromide, main structure here. Now, with this case, if we react this particular substance, what do we call it? Dimethyl, and obviously this is also an amine group, and so it will be ethanolamine. So, NN, dimethyl ethanolamine. So, if we react these two substances in presence of K2CO3, that is potassium carbonate, at 157 degrees centigrade for a duration of 16 minutes, you will get diphenhydramine. It's a very basic structure, very easy structure, and you can understand that one molecule of HBr or hydrobromic acid, they will get out as well. Now, next up what we have is the synthesis of triprolidine, and it is a little detailed structure and detailed synthesis that you must remember. In this case, the reaction starts with one particular substance which is known as 4'-methyl lactophenone, and this type of drug will not lactophenone, methyl acetophenone, and after reaction with pyrrolidine and CH2OX. Now, CH2OX is basically some typical type of carbohydrate and carbohydrates. These carbohydrates will be important here. And upon this reaction, what we will see is that the first substance that will be here is 4-methyl 3-pyrrolidine propiophenone. So, propiophenone because 1, 2, 3 structured. So, these things are there. So, it's a propiophenone, and after that this will be further reacted with 2-bromopyridine in presence of lithium ion, and this complex intermediate structure will be there. You need to remember this structure and the name as well. Now, a further reaction happens with hydrochloric acid. This will basically be creating the final product, that is triprolidine, and triprolidine is basically a racemic mixture. You can understand it has the cis and trans both are present there, and that is why this wiggly bond is present in this case. And finally, this will be separated by ion exchanger, and finally this triprolidine will be there. Now, the next type of synthesis which we have is of promethazine hydrochloride, a very common drug which is present. Now, promethazine hydrochloride, it will start with a very basic substance, and further it will be reacted with an amine, and this amine is also a tertiary amine, and in this case it will be reduced with sodium nitride, and finally the drug, the promethazine hydrochloride, will be synthesized. Next up what we have is the next class, and in the next class what we will discuss is mostly about the H2 type of antihistamines. And in case of these H2 antihistamines, what we will see is that H2 antihistamines basically are important for anti-acid, not antacid what we will say, but gastroesophageal reflux disorder. So, for these type of conditions, we will mostly look for the H2 antagonist. We will have the discussion about H2 antagonist and proton pump inhibitors together in the next class. So, thank you everyone for joining. After this thing, we will have some discussions. Thank you.